Well, greetings, everybody. It's good to have you with us again this Thursday. And as the numbers are starting to increase a bit here, just a real warm welcome, especially to Mark Blocher. Mark, thanks for being willing to join us on this Thursday afternoon. We're looking forward to this time together. Hope you're well. Looking forward to getting some updates as well during this time on how the center is going. But let me give just a brief introduction here. Probably some of you have awarenesses, but Mark has been a nationally known bioethicist for over 25 years, and he's the author of 2 books. The thing that really stands out to me and impresses me is that Mark has been involved in not only this ministry, but other non-for-profit ministries, including an inner city medical clinic and pregnancy care centers in several states. That really strikes me in terms of your depth of commitment and your stand in relationship to issues of our day that are so important, namely life itself. But anyway, Mark heads the Christian Health Center in Grand Rapids, and how many? Just a second, have I got you unmuted yet, Mark? I do not think so. Let me unmute you. Mark, how many, let's see, I've still got you there. As I'm trying to unmute you, it keeps bouncing back. Chris, maybe you can help me with that. It's a little different there. I guess I'll keep chatting until Chris gets you in. There you go.
I think I'm okay now.
Okay, great. So, Mark, how long have you headed the center in Grand Rapids?
Well, Christian Healthcare Centers was first organized and incorporated in 2015, and then we opened our doors to see patients in July of 2017. So we're coming up on our 3-year anniversary here in just another month or so. So it's been quite a ride here since 2015, 5 years that we've been incorporated. It's been in the works for longer than that, but.
Yeah, it's very exciting, and I'm wanting to have you be able to explain, probably as one of my early questions, as to exactly what the center is, and knowing too that that this will be also available with links, and a lot of people that don't join us on the Thursday circulate this, and we have much information that we want to make available to others. But as we begin, let's have a word of prayer together. Heavenly Father, God, we just come to you this afternoon now. We thank you for these opportunities to be able to tell the story, to be able to inform, to educate, Lord, to be able to point people to some of the concerning issues of our day, Lord, to have understanding, to be able to further live in a culture, in a world that's just changing so significantly, so rapidly. And so it is, Lord, to be able to speak with individuals like Mark and be able to understand some of the cutting edge areas where he has engaged now for so many years in different ways. Lord, we need your help. We need your touch. We're thankful for everybody that is here. Lord, help us as we learn in this time to take this information as you lead us and to share it with other people. And Lord, and even if we have new decisions to make, that you'll give us the courage to do that which you would have us to do. Now be with us in this time, we pray, in the name of Jesus. Amen.
Amen.
Mark, first of all, I would like to have you explain, what the center is, and some of the distinctives of it, and some of this is going to be a lengthy question, but why you found yourself being led and followed into this calling.
Well, I'll give you the Reader's Digest version of it. First of all, let me talk about it just from a practical standpoint. What is it that we do? Well, Christian Healthcare Centers it's like your doctor's office. You think of any doctor's office you go to for primary care visits, for preventative care, or you have a laceration, or you have an acute care situation where you've got particular symptoms. So we're a doctor's office. We have pediatricians, we have family medicine, internal medicine, and we also have OB-GYN care. We have a lab, we do our own x-rays, we have a dispensary for medications, and we have in-house counseling. So we're about as comprehensive as you can be in a primary care office. The vision for it is really to continue on that long history of Christian medical ministry that you can trace all the way back to Jesus' earthly ministry, and then the early church, its impact in the culture, the Roman and Greek culture of their day. And this is really an extension of that. So we brought this along, and we really believe God brought it along over a period of years, to where we need to launch a movement across the country that brings Christians back into the mainstream of healthcare. Too much is happening in our culture where Christians are being marginalized. They're being, their voices are being silenced because they're employed, and the employer says that, this is how you practice medicine. And for them to pray with their patients or to give spiritual care to their patients, they neither have the time, nor in many instances do they have the freedom. So we wanted to create an off-ramp for those doctors who really are believers that want to practice medicine according to their Christian values and according to the reasons they went into medicine, which was to provide patient care. We also wanted to provide it as an on-ramp for patients who are often falling through the cracks of our healthcare system. All of us have received a bill, I suppose, from an insurance carrier that we may have had or have, where the explanation of benefits it took an attorney with a law degree to be able to understand what they were talking about. And then you always saw those, this is what the facility or the doctors charged, and then this is what the insurance paid, and now here's what your responsibility is. We wanted to take all of that out of primary care. The only people that need to be in that exam room in the doctor's office is the doctor and the patient. And so we focus on patients. We don't bill any insurance. Instead of using insurance, we have like a gym membership where you pay a monthly fee and you receive the services that we provide here. So if you need an office visit, you get one. If you need an x-ray, you get one. If you need somebody to be sutured up, instead of going to the ER, you come to this office and we take care of those needs. If you break an arm, we take care of that here. And if it needs surgery, then we refer you out to an orthopedic surgeon who does the work of whether you need surgery or not. And they provide that to our patients at a discounted rate as well. So we've tried to put together an organization that is convenient, it's affordable, most importantly, Christ-centered, focused on practicing according to biblical values.
Yeah, that's a very, very succinct explanation of something that's somewhat complicated, but that's very understandable. You also have some working relationship with Samaritan Ministries, I believe.
We do. Samaritan Ministries is one of those medical expense sharing organizations that right now they have 82,000 households across the country that are part of that. And so the families join Samaritan, and instead of having insurance, high-priced insurance, the members of the body of Christ that are part of Samaritan share each other's medical expenses. So they've been a very big partner with us right from the get-go. The president and founder of Samaritan Ministries, as well as their legal counsel, they're members of our board of directors. So we're very, very well attached, if you will, at the hip in terms of their involvement with us. And we have a large number of patients that come from Samaritan, but also a lot of the other cost-sharing organizations as well. And we have insured patients. We have people that have no insurance at all. So we see patients that are very wealthy and also those that are very poor and many in between. We have patients from 32 different Michigan counties, 6 states, and 6 foreign countries that use us.
That really is incredible. And I think it must have been probably maybe upwards of 2 years ago now, maybe been longer as time flies, where we had you come and speak in Fremont, Michigan with us. And we had a local doctor, Dr. Ted Vanderkoy, and both of you dealt with some of the very questions I'm asking today. And as a result of that, has there been anything that has branched off from from your center as a result of meetings such as that?
Well, you'd be happy to hear we're in the process now of actually opening up an office in Newaygo. And that center, if everything goes the way it's looking right now, could be open sometime in mid to fall of 2021. Ted Vanderkoy is part of that, as well as several other physicians from the Newaygo area who want to be a part of it. So that it'll have the primary care side, the Christian Healthcare Centers side, and then we've also created within Christian Healthcare Centers a subsidiary. We haven't even named it yet. That's how recent this is. But it will be a subsidiary that provides medical specialties like general surgery, gynecology, urology, orthopedic surgery. And these are going to be in-office procedures and minor surgeries that don't require anesthesia. They don't have to be done in a outpatient surgery center. And so we'll be able to provide a broader scope of service out of that location in Newaygo. We already have a construction company involved and a developer, and there's a number of things happening on that front that we're pretty excited about. The city of Newaygo is involved in it, and the Chamber of Commerce. And so, yeah, the wheels are turning, Bill. They're really looking very positive right now.
It's very exciting. I know at a point when I was wanting to know more about your center, our staff came and spent some time, visited with you in your office there, and you gave us a couple of examples of cost savings that occurred, whereas a surgery in one place might cost this much, and by the fact that the existence of the center, you were able to cut those costs to a much more manageable figure. Can you come up with one or two examples of that to give people a vision of that kind of cost reduction?
Sure. Well, let me just talk about one on the primary care side. So recently we had one of our member families called us at 2:00 in the morning, and their 4-year-old son had fallen out of bed and cracked his head open. And so he had quite a gash. And instead of going to the ER, and that would have been probably $2,000 to $2,500, they called us. Our on-call physician said, "Why don't I meet you down at the center?" So they came down here to the center. The family arrived. They stitched him up, got him taken care of. They even took some pictures for posterity's sake. And they went home. And the cost to the family for that was nothing additional other than their monthly membership fee, as opposed to $2,000 or $2,500 if they'd gone to the ER. I could cite many cases like that. When we talk about procedures and surgeries done in office, Ted Vanderkoy has done them right here in the office. Minor surgeries, removing lipomas, taking out small cysts, taking care of moles. There's a number of simple things that he's done here, and he's even done some things that are even more involved than that. And instead of those things costing $3,000 to $5,000, they cost like $250.
Those are incredible accounts. Now, one of the things that others might want to know, including myself, is you are a bioethicist.
Correct.
Explain what that exactly is and entails.
Well, bio would cover, all of the areas of science, but particularly, life sciences, human science. My specialty area of bioethics is in human medicine and medical ethics. And so what that entails is consulting and teaching, speaking on issues related to the ethical issues in medicine, some of the major moral issues, whether we're talking about the entrance gates of life, talking about prenatal genetic diagnosis, we're talking about pregnancy and abortion, to the exit gates of life where you're dealing with issues of palliative care, comfort care, end-of-life decisions, and then all those things in between, things related to genetic technologies, talking about organ transplants, who gets what organ, if you've got 5 people that need the same organ, who gets the one they have, helping doctors think through those issues, helping nursing homes that have tough decisions to make about feeding tubes and other issues related to hydration and nutrition, working with families. One of the more recent things I did is consult with a family that had a daughter, 11 years old, that was hit by a car, and she was on a ventilator. and the doctors were wanting them to remove the ventilator because she had no brain activity. And so they asked me to come up and consult with them and with the hospital staff and help them walk through that. So that's some of the things that bioethicists do. We also are useful for doctors who face some difficult ethical issues. One of the more common ones I'm dealing with now has to do with professional conscience protections for employed physicians. So if you're employed by a large health system and they want you to participate in a procedure that your religious and your professional ethics won't permit you to do, sometimes they get threatened with being fired, or they don't get promoted, or they're kind of, blacklisted within their organization. So I consult with and help them walk through some of those issues. So that gives you an idea of the sort of things that I do.
It's helpful. I remember another question I asked of you was that in having doctors come and join with you, some do have to leave the large hospital setting, or desire to, and very, very much desire to, and that can be quite a decision for them to make, and it's on the basis of their Christian world and life view, I think, primarily, if not exclusively. Talk about that a bit, if you would.
Well, I think it's important that people understand the pressure that doctors are under today. Many of them, by being employed, have largely lost a lot of the freedom that they want and went into medicine to have, to be able to have real doctor-patient relationships and to be able to make real decisions for the benefit of their patients. And with big medicine, I'll call it big box medicine coming along, a lot of that has been suppressed. And so you have doctors now who feel like they're more or less a disease manager, that they get 8 to 12 minutes with a patient, and they don't get a lot of time to really build a relationship. And so a lot of them are burning out because they're expected to see 25, 30 patients a day. Well, if you're going to work 8 hours a day and you have 3 hours of paperwork to do at the end of the day related to all those visits, now you've got a 12, 13-hour day, and a lot of them are burning out. So we have a lot of physicians that contact us because they want to go back to practicing patient-focused medical practice. They don't want to, be payment-focused. They want to be patient-focused. But there aren't a lot of platforms for them to do that. A lot of them can't go into private practice, either because they have a non-compete in their contract with their employer, or they don't have the resources to start up a private practice. Well, if those are the only options, then if they want to do missional medicine, they pretty much have to go overseas or maybe volunteer at an inner city medical clinic, but there isn't anything really in mainstream medicine where they could migrate to that, when that's what Christian Healthcare Centers actually provides.
Mm-hmm. Now, one of the questions too that arises is that you work with hospitals in the area and probably beyond, so you could see that as sort of a competition where there might be a resentment against what you're doing, but as I recall, there's obviously a need for some real prayerful approaches to be an ambassador for Christ as you do extend your hand and try to work with other systems. Give us some thoughts and background on that, if you would, too, please.
Sure. Well, obviously, there are patients that need to be hospitalized. There are patients that need some of the specialized services that hospital systems have. And so we have no desire to create, and aggravate some kind of adversarial relationship with hospitals. Our argument is, we're not there to compete with them. Frankly, we're not big enough to be much of a threat to them. Maybe God will see to it that changes over time. But as it stands right now, we're really not a competitive threat to them. We number one, we don't have any insurance contracts, so we're not competing with any of the insurance reimbursements that they would be getting. And as I said, we use them. We have to hospitalize someone, so our doctors can admit people to all the area hospitals. Ted Vanderkoy still has privileges at Spectrum Health. Our OB-GYN has surgical privileges as well as labor and delivery privileges down at Spectrum Butterworth and all of the Spectrum facilities here in Grand Rapids. So yeah, we have a good relationship with them. There's not been any, I haven't experienced any, any negative pushback on us, at least not yet.
Well, that's fantastic. Now, in terms of the doctors, your medical staffing and so on, some of these individuals, by making a choice to be largely a part of the center, they make less money as a result of that. Is that not true? And is that just another reason to applaud them and the center itself?
Well, I would have to say that there's two things at work. There's our desire and what we're aiming for, our aspiration. We want to pay our doctors competitively. We want to pay them, at a competitive national level, and we adjust that for the region that we're in. With the realization, and all of the doctors that come and join this understand they're joining something that's missional. They're not joining something that has a large war chest of money that we can match the salary that they were making or that they were even making in their private practice. So a lot of the doctors that come here and talk to it, well, all of the doctors that have come here know they're coming here almost as a missionary doctor in a sense. We're not asking them to go out and raise their own support, but they come knowing they're not going to be paid what they would be paid elsewhere. But what I hear from them is they're happier than they've ever been. Even though they're paid less, they're having a lot more professional and personal satisfaction by being part of this. One of the reasons is because they have a much more balanced work life and family life. They're not having to do 3-4 hours of paperwork at night. So that really has made things a lot easier for their families.
That's beautiful as well. The thought that we understand that doctors do have a heavy load in terms of paperwork, and the thought that they can be freed of a significant number of hours in order to do that which many of them have been called to do, and that is to care for those that are brought into their life. That's wonderful. Now I'm going to switch directions here a little bit. I would like to be able to go now, and I gave you some forewarning on this because I wanted to make sure I wasn't throwing anything too rugged your way. We both understand the times are changing. So I have a few questions here I'd like to just ask you to help us understand and address. I want to right away, in our times here on these Thursdays, we have gotten into talking about the coronavirus, of course, and some of the spin-offs or the implications of the serious times that the coronavirus has brought. And so certainly you're not oblivious to any of this, but my first question is, how has the coronavirus pandemic affected the Christian Health Center?
It's really been encouraging actually to find out how this model that we use works in an emergency like a COVID emergency. And what we've discovered is what we've been doing all along. We've been using telemedicine since we opened our doors. We've had virtual visits. We've had visits like this. The last virtual visit we did was in India. The one before that was Ukraine. We've done them in Thailand. So where other offices were really scrambling to figure out how to do telehealth with their patients because they couldn't see them in the office, we had been doing that since our start. It was always part of our model. And to see how smoothly it went so that we were able to take people who were on the books to have in-office appointments for various things that really they didn't need to be in the office for, so we could take care of virtually. That was seamless. We were able to, because of the technology we had our doctors able to work from home if they needed to. They didn't have to be in the office every day. They could do all their televisits right from home. And we had secure network. We had the ability to have all their medical records in front of the doctor so that he could take care of the person as if they were in the room. The only difference was he couldn't, check their blood pressure and check their heart rate and so forth. And of course, there are increasingly numbers of wearable devices where that's going to be happening soon. The other thing I'd say is in terms of of our patients, we only had one person who actually contracted COVID-19, and they contracted that at one of the large hospitals here locally. They didn't get that here, and they were never in our building. But what we did is we accommodated our facility so that we saw people that had urgent care needs that didn't have any symptoms. We saw them on one side of the building. And then those that had any kind of symptoms, respiratory issues and so forth, we had 2 rooms that we isolated and sanitized after each visit and so forth. And they came in through a separate entrance, and we were able to accommodate them, and it was very seamless. So we really didn't have a problem with our patients having access to care.
That's really an incredible word. And even the telemed, that seems to be, that has got to be exciting to see how care can be met, needs can be met in that way. Can you give an example of something that was particularly noteworthy to you?
Well, from a remote standpoint, I'll just talk about the case in India. It's a missionary family, and there were some concerns about a particular condition they had that was pneumonia-like. And while our doctor couldn't physically examine them, they were able to guide them through more or less a self-examination to determine, did they need to go to the hospital? Do they need to seek that kind of medical care? Fortunately, they didn't need to. There were some basic medications that they could get locally that they were able to use, and the situation cleared up. Another one was in Thailand, similar type of thing. We had one where somebody had a kind of a goofy looking rash, and so they did a telehealth visit remotely, and the doctor was able to take a look at the rash. They were able to put the camera right on it and show what was going on, and they were able to prescribe a particular kind of ointment, and that cleared up. I mean, obviously, you're not going to deal with a heart attack, through telehealth. You're not going to do surgery, not yet anyway. But robotics being what they are, the day is coming where doctors probably will be able to do that. But right now, for us, we're able to do a lot of those things that often cause people to have to drive into the office, and if you're a young mom with young kids, you got to drag the whole family in. Instead of having to do that, we do a lot of those visits virtually. Makes it much more convenient, for moms, people that have jobs that don't want to take a half a day off work to go sit in the doctor's office, and especially sit in a waiting room with 20 other people. We can do a lot of those things virtually.
What is the criteria for, let's say a person calls in from my community here in Fremont that has a special need with a child, and most would desire not to have to come in, but there must be some screening process of saying, you're going to have to come in for this or that or whatever. What are the determinators?
Well, every patient would be triaged by one of our clinicians, and there's certain symptoms that if those are manifested, those are ones you need to see the patient. You have them come in. But what you don't need people to come in for is a lot of times moms know this if they have more than one child. Hey, I think my child has pink eye, and so let's check this out virtually to see if they need to come in or not. Or strep. I mean, we send families home with home test strips for strep, and we have them run that strip if they have a child that's manifesting symptoms that they think is strep. Run the test, and if it comes back positive, then we've got a couple of options. One, if their symptoms are not horribly severe, let's get an antibiotic started. And what pharmacy do you want us to send the prescription to? And antibiotics, as you probably know, are very, very inexpensive, if not free in most pharmacies. And, if you got somebody in Fremont and they can get a prescription locally and they don't have to drive to Grand Rapids to be seen by the doctor because, both the doctor and the mom pretty well know what this is. And then you give it 24, 48 hours and see if the symptoms have cleared up at all. If you've got more acute symptoms, then you might want to have them come into the office. If they're really acute, then you are going to send them, to the ER because you don't want anything to develop into a life-threatening condition.
That's helpful. We'll go back into some of the controversial area, perhaps. I want to ask you, do you feel that the COVID response by way of the Center for Disease Control has been appropriate, or have they gone overboard in your view?
Well, in my view, and I'm probably, in a camp where the first few weeks of this whole thing, because there was so much that we didn't know about it, I was okay. Let's follow the initial advice that we're being given here, and let's take at face value what we're being told the science is. And I think we're all aware as this began to unfold that the science, so-called, was definitely not settled. And what we were hearing coming out of the CDC seemed to change a great deal from day to day, week to week. And then we heard things from NIH coming out, from the World Health Organization, where there didn't seem to be a solid consensus on what was going on. And furthermore, there were some things that were being said that people needed to do that just didn't make sense, that just, didn't pass the common sense test. And so for us, what we did is we did the same things that we do during flu season. We have people kind of screened before they come in, because we don't want people sitting in the waiting room and contaminating others. So what we did during this whole COVID thing is we basically shut down our waiting room. So when we had people come and they were going to be seen by a physician, as I said earlier, they would come to a separate entrance and they would wait in their car. They'd call us, let us know they were there, and then we would go out and get them and bring them in and take them into one of the rooms that we isolated from everything else in the building. We were doing those things largely even before this whole thing broke loose. So my basic comment right now, and I'm speaking more personally than, as an organization, I take what I hear from the CDC with a grain of salt. I don't know what to believe. But I do know what I see. I do know what I see in our practice. I do know what I see in my neighborhood, in my community, and I don't think that that we've done people great favor in Escanaba, Michigan. When somebody dies in Detroit from this virus, why are we shutting down hair salons and barbershops and businesses in Escanaba? 400 and some miles away. I don't understand that.
Certainly, and that's a concern, I'm sure, of many folks that would pay attention to our work and large numbers of others, certainly. But one of the views that is really being, not, I wouldn't say tossed around, but more and more absorbed, certainly from the Christian conservative community, has been that there's an agenda that's behind this whole coronavirus, and that it is even globalist in nature, that there's a desire to enable the people of the world, because this is not just an American thing, it's across the world. And we see how people have, in these little communities, like you say, like Fremont, Escanaba, and elsewhere, are the pressures to bring a panic to folks, that they maintain the distance, social distancing, and the masking when there hasn't hardly been any kind of an outbreak at all, and we don't trust the facts and the statistics, that there's a view that there's a globalist desire, that the hold that they have upon the world is something that they will not soon be releasing, if ever, that they're trying to turn the people into a bunch of sheeplets so that they can hold on to the ground that they've gained, and what we've lost, our freedoms, and take a little bit by a little bit, more and more, using this medical issue even to shut down our schools. Even there are many questions about whether it will continue in the fall. These are serious questions, and I'm wondering if you would share any thoughts that you might have towards that.
Well, when you take in the totality of everything that has unfolded, and you begin to try to make sense out of it. What's the best explanation for the convergence of so many of these things that could, on the face, it could look like they're episodes and developments that are happening independent of one another. So, I'm not sitting here necessarily thinking there is some grand human conspiracy that is taking advantage of this particular thing, or for that matter, the open question, unanswered question of, did China, do this intentionally, or was this just their opportunity to kind of do a dress rehearsal of what would it take to take down major powers in the world, the U.S. being certainly premier among those. And it certainly was that, whether they intended it or not. You couldn't have gotten a better dress rehearsal of what does it take to basically immobilize the United States economy and immobilize the people in the United States. They got a dress rehearsal for how to do that. So did every terrorist in the rest of the world. The other side of that is, whether or not this was, had a political motivation to it at its inception, it certainly has become that. And when you look at the disproportionate way, for example, that the religious community has been treated versus big box stores. So why can I have 50 people in the paint aisle at Home Depot, but I can't have people gathering together for worship? When you see the disproportionate treatment of businesses, or for that matter, some people being deemed essential and other people not being deemed essential, and how quickly, in my view, our elected officials, many of them took off in a direction they didn't have the law behind them to do. And of course, that's still in dispute, and it'll get sorted out in the courts. But I still can't figure out, where the pandemic clause is in the First Amendment and the Constitution. I haven't found out where, the COVID-19 clause in the First Amendment is, where you can suspend religious freedom because, we've got this national emergency. And furthermore, when it's being done by, among them, our own governor, when they're doing this in defiance of their own legislatures. My understanding of the law is that governors can enforce laws passed by the legislature. If the legislature doesn't pass a law, they don't have a law to enforce. So I'd like to know how they can enforce whether you wear a mask or not, or whether they can enforce whether you can only have a certain number of people gathering for worship or not. And I'm not, the inference to the best explanation for it, Bill, I think, is there are people taking advantage of it. And people should have their eyes wide open. If you wanted to get a taste of what socialism would look like, all you have to do is look at how fast we passed multi-trillion-dollar pieces of legislation, printing funny money in the trillions that are going to cost my grandchildren and great-grandchildren their own quality of life. All you have to do is take a look at how quickly they shut down entire states, shut down entire businesses, ordered businesses to produce products that they weren't producing before, and the way they've abused our law enforcement. And I was a chaplain for the Michigan State Police for 15 years. I'm just greatly grieved at how our governor has misused the Michigan State Police. And they took an oath of office to the Constitution. They didn't take an oath of office to the governor.
Well, thank you for that very forthright answer. And we're grieved ourselves on many fronts that you mentioned and described here. I think another great controversy that still is existing out there, and this is rather divisive as well, though from my vantage point, it seems like people are nonetheless quite cordial to each other, at least over here in this portion of West Michigan. But it's the whole matter of masking that continues. I always ask my wife when she goes to Meijer or Walmart, what are the percentage these days in terms of how many are masking, how many are not. And so there are some that really, I understand the sensitivity needed when you have an elderly person or somebody that has some real health issues of going beyond the shadow of a doubt of just exercising that great care. But I understand that, and I can participate in that. But there's also a lot of scientific information that's coming out and saying that the masks are not effective. In fact, they're not even a healthy thing for a person to have to don for any period of time. like you to comment upon that, the effectiveness or ineffective of it, and also in regards to social distancing.
Well, just on the question of masking, you know, just on that issue,
Mhm.
um, we've received conflicting guidelines from the CDC. One time it's, yep, you should wear masks. And the next time, well, no, they're really not that beneficial. Well, maybe they are. Well, maybe in enclosed spaces. Uh,
Mhm.
and then you had state health directors adding further to the conflict in the messaging. So the confused mind says no. And when it comes down to, am I going to wear a mask or not? Well, if I've got all this confusing information, here's what it comes down to for me. If you feel safer wearing a mask, wear one. And if I don't need, if I don't feel that I need to wear one, I'm not going to wear one. But I don't know where the law was ever passed by a legislature in this state or any other state that mandated that during a medical, quote, emergency, everybody had to wear a mask every place they went. As far as the efficacy of masks, obviously they work. There's certain kinds of masks that work in a highly contagious environment, but masks by themselves aren't going to prevent this. Why didn't they mandate eye covering too? Because that apparently was a port of entry for this virus. Why just the nose and the mouth? Why not the eyes? Um, you begin to wonder, does it become a symbol of the power that people are exercising? That if we get everybody to comply, then that means that they've recognized our power, basically, to make these kinds of minute decisions about how they're going to live their lives. And you know, I'm a converted hippie. I was a hippie in the 1960s, so there's a kind of a nonconformist streak in me to begin with. Um, I wear a mask in our office when I need to, when I'm supposed to. I don't want people here feeling that this is not a safe place for them. But you know what? There are times when we don't. There are times when, you know, we're meeting together and we're having lunch. People aren't wearing their masks. And frankly, um, I my personal view, I think they've overplayed their hand on that. And what they have done, Bill, as you noted, is they've turned people back on their neighbors. You know, they've caused total strangers to walk up to other people and accost them for not wearing a mask. You know, I've had people say that to me, hey, you're not wearing a mask. Say, listen, I'm 68 years old. Um, I feel totally free and I'm willing to take the risk. But you know what? If you don't feel safe and if you don't feel safe around me because I'm not wearing a mask, then I'd say maybe you should be 12 feet away from me instead of 6.
Mhm. Yeah, I think those are excellent thoughts, and I think that it's an unfortunate thing, the division that this can bring. And I know you used the word earlier, a dress rehearsal for perhaps those that are drawn to exerting power around the world, and even in our local states. If they can bring this down upon the populace, how about the next step? You know, what would that entail? So it's a very concerning time. It's also seems as though, you know, when we just go look back 5 6 years ago, or even 2 or 3 years ago, just a sense of, you know, not to say we haven't had discord, but this does take us to what I hope does not turn out to be a new normal, because it certainly means it's an assault upon our on our freedoms like we've never seen before. I wanted to ask you about Dr. Fauci. What your thoughts are in relationship to him. There are numbers of us, and I would include myself in that, are very nervous about this doctor, and it seems as though he has been used by all kinds of the doctors, presidents over the last several years, and so it's quite shocking to us that Donald Trump, who is known as a nationalist, is allowing Fauci to drive so much of the plans. It seems because he is a noted globalist. Your thoughts about him?
Yeah. Well, his connections with the National Institutes of Health, I think, is why he was, in a place to be tapped by the president. I think the president, tapped into kind of the existing uh, authorities that were involved in national health, and whether it was the CDC or NIH, some of the others, Surgeon General. Um, my personal views, based on things that I've read about him, things that I have, listened to and heard about Dr. Fauci, I think he has a past that gives rise to some concern about why is there such a huge push on his part for we've got to kind of keep things tamped down till there's a vaccine, when there are questions about his own personal involvement with previous vaccines and whether or not he stood to profit from any of those. And I understand that there were a couple of different vaccines related to HIV and AIDS that he was involved with, and I can't remember what the other one was for, that his name was on the patent. And of course his answer to that was, well, that was required by law, that somebody from the NIH had to put their name on it, so he put his name on it. Well, and that any royalties that he received from that he had donated to charity. Since I don't have reasons to think otherwise, I'll give him the benefit of the doubt, and I'll just show me the charities you donated to. Did you give those to Planned Parenthood? Did you give those to organizations that we would say, gee, that's not exactly what I'd call a charitable organization. But the fact that he pushes vaccines so hard, and he was so strongly against using some of the other ways and therapies that people suggested, kind of gave me a thought that, I'm not sure we're getting the straight scoop from him. The other thing that I would say is, like the CDC, we kept getting conflicting information. So one day the science was supposedly this, and then the next day the science is over here. And as I said earlier, the confused mind then says, no, I'm confused enough. I don't know what to believe. And so then people had to start using their common sense. I think there were others also that were part of the task force that give me pause in terms of really what their motives are. But, when I, extrapolate off of that to say, if the governors that shut down their states so strongly, among them Michigan, were depending on the science they were getting from Fauci and Birx and some of the others, it seems to me that they overreacted. Maybe in the initial days you could see some of the shutdown, but it became very apparent that the numbers weren't trending in the direction that they had projected that they were, even to the point where now, Andrew Cuomo, the governor of New York, says, hey, all the models were wrong. We were all wrong about them. Well, if the models were all wrong, then why in the world did we shut down the entire country and bankrupt a bunch of businesses and put 40 million people out of work? Not to mention suspend people's constitutional rights. If we did that using flawed science, how in the world am I supposed to believe science when it comes to some of the other issues they want me to believe? Climate change being one of them.
Yeah, that's huge. The whole matter of the vulnerability that it puts our country in with the great spending bills that you had mentioned, and the high unemployment, where it's going to be very difficult to climb out of this. And we have enemies within and enemies without that must just be salivating over the vulnerable spot that we find ourselves in right now. And I don't think there's going to be this is something, like you said, that our grandchildren and our great grandchildren should we survive as a nation, are going to have to be dealing with for a long, long time, obviously.
Well, and Bill, I would add to that this, and we haven't really talked much about this. What this has revealed for me is not only how fragile our government is, how fragile our economy and our culture is, but it also revealed how fragile our churches are. Mm-hmm. And we could spend a whole episode just talking about that. My concern is that if the church doesn't learn important lessons about its role in society from this and take steps to carry out God's calling of what they're supposed to be in this culture, I think we're going to have some serious problems down the road. Because what happens if we, and I'm going to use a strong word here, if the church rolls over for this and says, okay, you can take away our constitutional freedom to worship and gather and practice our faith as we deem necessary. If they do it over this, what are we going to do when it really gets intense? What's going to happen to the church when they really are going to take pastors and haul them off to jail? Or they are going to go in and seize the property and padlock the doors like they've done some businesses? If we've got elected officials who are willing to use the instruments of the state to execute, in essence, a police state for this, what will stop it for something that's really significant, something that's really big? And I'm not saying losing 100,000 people's lives is not an important, significant thing, but I can envision some other opportunities that might come along the way where those who are emboldened by what they saw governors do and mayors do in this instance, they just take it the next step. They already tried to shut down churches in various states and keep them locked. I mean, de Blasio in New York said that he was going to shut them down permanently. I'd like to see him try that.
Yeah, I think that one of the questions that I have, and this I think is that really is difficult in this sense, that when churches have had a difficult decision to make in regards to, they gave the governments a several week period of time, to go along with them in terms of the shutdown, or no more than 5 people, or whatever their particular calling was. But slowly, very, very slowly, it seems like churches are now going back to worship. When is masking when should masking be a thing of the past? When should every other role be a thing of the past? Is that also just, again, submitting to panic and hysteria? Your thoughts on that? Yeah. That's it's a difficult one.
Well, here's I guess where I would say my baseline is, and that is this: if you are willing to gather with your brothers and sisters for worship, and whatever risk that is, if you've got health problems, if you've got a compromised immune system, and you don't feel comfortable gathering with people, whether a large or small group, for worship, etc., then don't do that. But here's what I don't think is necessary. We don't have to shut down the entire church because there are a few people who feel vulnerable. We don't have to shut down an entire usually you quarantine the sick. You set them apart from the healthy. You don't quarantine everybody from everybody else. So for the church, what I would say is, when the church says, you know what, if you want to wear a mask and you feel better about wearing a mask, wear one. And if you don't feel you need to wear one, don't wear one. If you want to sit next to a brother or sister in the sanctuary and worship together, sit next to them. And if you don't feel safe doing that, then don't. If you don't feel safe gathering, we'll continue our virtual worship services and you can worship that way. Our church has been doing that long before COVID came along. So a lot of our folks were already used to that. Now we're gathering as a family again. And what I just described, mask, no mask, all of that's pretty much up to the individuals.
Yeah, that's helpful. I think your comment when you said, you're 68 years old, I'm 73 years old, and so I know that those that are moving up into those territories, the facts are that those are the populations that are basically dying of the virus, more so than the youth, certainly. But it's a wonderful thing to know the Lord and to know where we're going when that day comes, whether it comes by way of whatever accident, that we can rest assured we have this assurance. And I think one of the things that troubles me so much is that that seems to be reflective, particularly of the masses of people that are of a much younger age. It's that mask seems way too important to them than I think that it should be to them. You know, as Christians, can it not be that we our help and our hope is in the Lord, especially in the midst of that minimal statistic of death? I think that's one of the things that really grips me, Mark, and
Yeah.
it makes me very troubled over the spiritual condition of our nation.
Well, where I come at it, the angle I come at it from is this. I look at the history of the church and how it has responded in previous plagues and pandemics. And yes, there were people who avoided getting into places where they might, contract a condition. But what I saw from the early church is they went places and cared for people when nobody else would. The thing that brought the Roman Empire to its knees was not an army. It was their fear of these pandemics. And during the pandemics, even though the Christians were the ones that were being persecuted right and left, and they were the ones being incarcerated because supposedly they were the troublemakers, when
Mhm.
it came down to it, who took care of the people that were left on the streets to die by their own families during the pandemics? It was Christians.
Mhm.
And what's interesting is that history shows that the infection rates among Christians was much lower than the general population. As a 68-year-old, here's where I'm at.
Mhm.
Number one, my future's in God's hands. I'm not going to be foolish, but I'm not going to be fearful either. They talk about flattening the curve. We need to
Mhm.
flatten the fear.
Mhm.
We need to have a flattening of the fear among Christians that, listen, what's the worst that could happen to me if I reach out and I minister to people and care for them and do my job and serve? The worst is that I die and go to heaven. Well, how bad is that? Yeah, there are things I would miss here, and I understand the fear. I've got a 91-year-old mother who right now is in a nursing home and in hospice because she's actively dying. Um, I don't want her to die from COVID. And I don't want somebody to lie on her death certificate and say that she died from COVID because she does not have it.
Mhm.
But what I would say is she's looking forward to heaven. She's looking forward to being with her Savior. And I am too. And yeah, I'd like to see my grandchildren grow up and get married and see great grandchildren, but that's in God's hands. That's not mine. Now, I'm not going to go out and intentionally step in front of a bullet or a bus, and
Mhm.
say, well, if heaven's such a great place, let's hasten the process of getting there. I'm not going to do that. But I am going to trust God that I'm here to serve. And we started a healthcare ministry, and we're not closing our doors in fear and saying to our patients, well, sorry, at the time when you need us most, we're just going to shut down, like the rest of our healthcare system largely did. My mother could not get in to see her own doctor that she's had for 25 years to get an assessment that ultimately we brought her back to Christian healthcare centers
Mhm.
and took care of her here. And she ended up getting a CT and an MRI that diagnosed that she had a very fast growing brain tumor that it resulted in her going into hospice care. We wouldn't have known that if we
Mhm.
waited for the traditional fee for service system to work.
Mhm.
So why would we have people in medicine be so fearful of doing what they're supposed to be able to do, which is to care for the people when they need you? And my hat's off to those that were in ICU units and working in ERs, and the people that had to deal with those that really were in serious condition. I have great admiration for them. They are courageous. That's the kind of courage Christians need to have because we already know what our destiny is.
Yeah, I love that passion, and it marks you, and that's wonderful. And a question I was going to ask you is: it seems I have family that are surgeons, and has headed an ER in Clinton County once upon a time, and there seems to be such a strength of concern and commitment from medical people regarding wearing masks. You feel like you're living in sin if you aren't one that upholds that. Do you have any sense of like what the percentage of that is? It seems very high to me that we are somehow out of the will of God if we don't wear masks and we're around medical people.
Well, I'm around medical people every day, and some wear their masks everywhere they go, and some don't. In our office, we wear them more for the reason we don't want to cause any discomfort or fear among our patients. And our patients coming in, we offer them a mask if they don't have one. And we sanitize, and we've got the, all of the various things that CDCs have requested their offices have. But we just interviewed a physician here last week, a family practice doctor who works in urgent care and is coming on board here starting in August. We had that whole meeting and nobody wore a mask. And, you think, well, somebody's coming from urgent care, they could have, been infected. Well, they test them all the time. They check their temperatures. When you check temperatures, you check, you have people that are being tested regularly. Why are you continuing to live in fear? Now, I'll tell you this, there's a big difference between someone working in our office and someone working in an intensive care unit and intubating people who are struggling, for breath because of this COVID-19. It's a real virus. There's nothing Mickey Mouse about that. But at the same time, when you're in that kind of environment all the time, you're used to everybody wearing masks. You're used to everybody wearing PPE, doing all the sanitizing, et cetera. And when you're in other environments where you don't see people doing that, to me, that's where the lack of common sense on the part of our government officials really has spawned a reaction within our culture that I think is unnecessary.
That's a helpful perspective. As we move towards closing, Mark, one of the questions I have for you is this. It's what advantages does the Christian Healthcare Center offer to any audience, particularly a Christian, seeking Christian healthcare? In a sense, you've answered at the beginning, but I would say bring it all together as in this statement.
Well, in a very simple way, I would say this. Does it matter to you as a patient whether you have a doctor who shares your values, your beliefs, your views about life, your views about end of life, etc.? Does it matter to you that you have a doctor who's there when you need them? You've got the doctor's cell phone. You don't have to go through 5 different levels of a phone tree to maybe get a call back from the doctor and get a 2 or 3 minute visit. If you need to talk to them, they're there to talk to you. Does that matter? Does it matter that the doctor will spend 30, 60, or 90 minutes with you in an office visit and give you the time that you need to have your questions answered? Does it matter that the doctor will pray with you? Does it matter if the doctor will ask questions from you, of you, such as, how can I best address needs in your life that will improve your quality of life? In fact, that's a common question that our doctors ask. At some point in the visit, they'll say, what problem, if I could solve one problem in your life that would most improve your quality of life, what would that be? Most doctors don't ask that question because, number one, they don't have the time to hear the answer and do anything about it if they do hear the answer. And guess what people never answer? They never answer, doc, if you could just improve my blood pressure, if you could just improve my cholesterol. No, they talk about their family. They talk about relationships. They talk about the things that cause stress in their life. Those are the things doctors don't get paid to address because the fee-for-service insurance system doesn't have a code for that. We deal with marriages. We're able to help families that have never seen a counselor, that have never dealt with childhood adverse experiences they had as children, and we're able to walk them down the hall and introduce them to a counselor and say, here's Lisa, let's work together, the 3 of us, to address the problem and the need that you have in your life. If those things are important to you, then cost becomes less important. But why would you not want to support an organization that also reaches out aggressively to support abortion-minded women? We have abortion-minded women that come to us from pregnancy centers. Medical care is one of the key things they need if they're going to continue that pregnancy. We just delivered this week the baby of one of those moms. We call it Healthy Tomorrow, as a Healthy Tomorrow's mom, who now is also going to continue her care with us for primary care for herself, well woman care, and well child care. Why wouldn't you want to be part of an organization that actually provides the real alternative to abortion that an organization like Christian Healthcare Centers does?
You're a good man to be in the very spot that you're in. I praise God that He's put you in that spot. And I'd like to be able to take a few minutes for a few questions if you've got a few minutes yet, Mark.
I'd be happy to take those.
The best way that we have right now is by way of anybody that wants to submit something by chat. Or here's a comment from Garrett, who thanks us for our ministry for bringing you on, and they bless you, and you're a courageous warrior for Christ. That's a very sweet statement.
Thank you. I appreciate that.
It's very kind. So anybody else that would have a statement of some kind or another, or a question? Well, we did cover an awful lot of ground apparently, but it certainly is a pleasure to have you once again to do this. And we'll have to revisit this again sometime along the way as the Lord leads us. But Mark, I just want to thank you so much for being a part of us today. And we just bless you as you continue. I would ask you, Mark, as a brother in the Lord, if you would close with a word of prayer. Thank you so much.
I sure will. Thanks. Father, we give you thanks for your provision for us, your protection, for the assurance that we have that regardless of whatever happens to us in this world, we're still under your sovereign control and your providential moving in our lives. Thank you for Bill and for the ministry that he leads, for the lives that it impacts, and for his stand for your truth for all these years. I just would pray a blessing on him and his family, safety, protection, health, and prosper the ministry. Bless each person who joined this podcast, Lord. Minister to them. God, fill their hearts with faith and hope, and remove the fear that man puts there. Let us not be fearful of what men do. Let us do what the writer of Proverbs said, and that is that we need to fear God. That's the principal part of wisdom. We thank you for all you blessed us with. In Jesus' name, amen.
Amen. A wonderful prayer for a great time with you, Mark. Bless you and your family. We'll look forward to talking to you again sometime as the Lord leads. Thanks again.
Been my pleasure. Thanks.